Okay, so the last part of this little chart for Goodman Chapter 5. So steroids, their purpose is to develop secondary male characteristics and build muscle tissue. Their mechanism of action is to diffuse across cell membranes and bind to glucocorticoid receptors, causing changes in the receptor. Adverse effects include increase in sex drive, acne, increase in the body hair, aggressive behavior, development of thrombosis, and their risk factors include males using with drugs and alcohol as well as tobacco. So for chemotherapy, the purpose is to cure cancer, palliate or stabilize disease before bone transplantation, and the goal is to destroy malignant cells within least harm to the normal cells or the host. Categories of chemo drugs include systemic drugs, alkylating agents, antimetabolites, antibiotics, and plant alkaloids. So we know that systemic drugs, they travel through the body rather than remaining confined to a specific area. Alkylating agents, they insert themselves into DNA strands. By disrupting the normal structure of the strand, they prevent successful replication of an exact copy of DNA strand, creating a break in DNA strand. For antimetabolites, they act as being incorporated into DNA strand or by inhibiting enzyme necessary for DNA and RNA replication as well as protein synthesis. Antibiotics are found within the DNA strand, preventing the synthesis of DNA and RNA, and it can lead to formation of free radicals, which can damage DNA and cell membranes. Plant alkaloids are effective in treating cancers. They interfere with the formation of the mitotic spindle, subcellular structures that transfer genetic material from the mother cell to the two daughter cells. Chemoprevention is developed to decrease the risk of reoccurrence of cancer after primary treatment by surgery, radiation, and chemotherapy. The SERMs are used to block the ability of estrogen to stimulate tumor growth in estrogen-positive tumors. Side effects will include hot flashes, vaginal bleeding, atrophy and dryness, endometrial cancer, blood clots, depression, fatigue, and vaginal atrophy. So for aromatase inhibitors, they block an enzyme called aromatase, which changes androgens produced by the adrenal gland in postmenopausal women into the estrogens. And then recommendations include exercise as well as weight management. Adverse effects of chemotherapy include nausea, vomiting, mucositis, diarrhea, myelosuppression, alopecia, also known as hair loss, and sterility, as well as toxic to the fetus. Types of toxicities include gastrointestinal, cardio, pulmonary, renal, and hepatic. So for gastrointestinal, these cause damage to cells inside the mucous lining of that GI system. Symptoms will include abdominal pain, bloating, nausea, vomiting, diarrhea, and constipation. Risk factors depend on your age, sex, and previous history of nausea or vomiting. For cardio, you have class 1 and class 2. So class 1 is permanent damage to that heart. Class 2, it can be reversed and is less serious. So symptoms include cardiomyopathy with a decrease in left ventricular ejection fraction, symptomatic heart failure, arrhythmias, myocarditis, myocardial infarction, and pericarditis. Risk factors include dose, infusion rate, younger and advanced age, exposure to mediastinal radiation, previous heart disease, and hypertension. Pulmonary, that ranges from bronchospasm to pneumonitis to acute lung injuries. Symptoms can occur for up to 2 years after completion of treatment, and risks include advancing age, tobacco use, concomitant irradiation, and size of accumulated dose. For renal, these are chemotherapy agents and drugs that are metabolized and excreted by the kidneys. So things that can potentially be backed up when the kidneys are trying to excrete them. Symptoms will include irritation of that bladder, causing bleeding, pain, and irritation, vomiting and fever, nausea, headache, and abdominal pain, constipation, diarrhea, respiratory distress, sepsis, and rash. Risk factors include clients who have insufficiency before treatment, large tumors, or rapidly dividing tumors that are sensitive to chemo, leukemias, or lymphomas. Hepatic, the next category. So these are cancer treatments that are used, agents that are metabolized by the liver. So these are things that are made by the liver. So symptoms include sinusoidal obstruction syndrome or veno-occlusive disease of the liver. Liver has little reserve to tolerate surgery. And risk factors include age, gender, genetic interaction, or with currently used drugs, past history of drugs, alcohol, poor nutrition status, and presence of underlying liver disease. Neuropathies. This is whenever drugs have an increasing concentrations in that DRG or the dorsal root ganglion, and signs and symptoms include numbness, tingling, or burning of the hands and feet, progressing in a distal to proximal pattern, and diminished or absent deep tendon reflexes, decrease in balance, gait, and stability, and decreased fine motor coordinations. So, chemotherapy-related considerations for the client. So, an increase in a risk for acquiring an infection because these drugs often decrease the amount of white blood cell numbers. Decrease in hemoglobin, hematocrit, and red blood cell numbers can compromise ability to engage in physical activity, and mood changes such as euphoria, depression, and irritability. Late effects of chemotherapy include not something that doesn't appear for many years after treatment, cardiac damage that lasts 5 to 20 years after treatment, growth hormone deficiencies, risk modified by survivors' genetics, lifestyles, and comorbid health conditions. Survivors are at an increased risk of morbidity, mortality, and decreased risk of quality of life. Survivors of childhood cancer are more at risk. Next category is specific disorders affecting multiple systems. So you have vasculitis, rheumatoid arthritis, systemic lupus, systemic sclerosis, tuberculosis, sarcoidosis, and sepsis. So for vasculitis, this is when many diseases act together from inflammation in the blood vessel walls that cause narrowing or blockage and aneurysm formation or rupture. Rheumatoid arthritis is something that is an autoimmune disorder, and it affects synovial tissues and joints. Systemic lupus erythematosus is a very complex disease that affects the heart, kidneys, and CNS. Systemic sclerosis is more of a generalized connective tissue disorder that doesn't really have a specific cause, and it's characterized by the immune system becoming deregulated, microangiopathy, and fibrosis of the skin and internal organs. Tuberculosis is something that can be either acute or chronic. It's caused by this bacteria called Mycobacterium tuberculosis. So for sarcoidosis, this is characterized by whenever something forms that is non-caseating granulomas. The core of monocyte-derived epithelioid cells and multinucleated Grant cells interspaced with or surrounded by lymphocytes. And finally, sepsis is involving both the invasion of microorganisms and response of the host, resulting in hyperinflammation and soft tissue injury. So host becomes invaded, causing a lot of these inflammatory issues that cause a soft tissue injury.